I started working as a labor and delivery nurse, I was actually shocked at how many perfectly healthy and normal births turned into C-sections. Did you know that 1 in 3 births in the United States end up in a C-section, with that total number actually creeping up to near 40% of all births? However, the World Health Organization has actually come out and stated that an optimal C-section rate is somewhere between 10 to 15% of births for healthy outcomes. So we're obviously way above that number. The truth is that a large amount of C-sections could actually be avoided by following best birth practices. So if you're planning for a natural birth and you want to know ways to reduce your risk of a C-section, then stick around, because in this video, I'm going to be sharing 6 proven strategies that can help you stay in control of your birth experience and prevent unwanted outcomes. Let's go ahead and dive in. Hello, my friend. If we haven't met yet, my name is Eve. I am a former labor and delivery nurse turned birth doula and a Catholic mama to 2 sweet babies who is super passionate about helping other women prepare for God-centered natural births that they will love. If you'd like to see more weekly content like this, go ahead and hit that subscribe button and the bell notification to be notified when I post. It would mean the world to me, and I'd love to see you back here. The first tip to implement in order to avoid an unnecessary C-section is to hire a doula. A doula is a trained non-medical professional who provides informational, emotional, and physical support throughout the pregnancy and birth process. Several studies show that having a doula present at your birth actually lowers your risk for getting pain medication in labor, improves birth satisfaction, and decreases the risk of an unnecessary C-section significantly. Having a doula present at your birth is super valuable because they are a trained professional and they can advocate for you in ways that maybe your other support people cannot. They're also trained in methods and techniques to help you stay calm and grounded, to use breathing and other coping mechanisms throughout your labor, and overall their presence can just reduce stress and help things to go as smoothly as possible. One meta-analysis of 16 different studies actually showed that women who had doulas present at their birth were 68% less likely to have an unnecessary C-section than those who received standard prenatal care. 68%. That is so significant. So hiring a birth doula increases your chances of having a natural vaginal delivery and decreases your likelihood of an unnecessary C-section significantly. So this is number 1. The second tip is to make sure you're choosing an aligned provider to help you deliver your baby. Your choice in birth provider is going to significantly impact your birth experience and your birth outcome. Every birth provider is going to come with their own bias towards birth, bias towards you as the birthing woman, and their own set of beliefs and practices. If you want to avoid an unnecessary C-section, it's really important that you're asking your provider the right questions during your prenatal care to make sure that they're truly aligned and supportive of your birth goals. Make sure that you're asking them specific questions about how they would practice in certain situations. Make sure that you're asking them about their induction rate and their C-section rate, and those are numbers that they really should know, and be aware of any red flag language that's being used, such as "I won't allow you to," or saying things that really show they don't believe birth is a normal process, such as "your baby's probably going to be too big to fit," etc. If you're delivering in a hospital or a birth center, definitely ask them about their protocols, and you should be informed on how those protocols could impact your birth experience. And even though all of those questions are hard to ask, they're really important. And in my birth course, we dive in way more detail about how to have those hard conversations with your care provider. Most often, midwives or out-of-hospital birth providers are going to have a much lower C-section rate, and if the provider that you're currently with doesn't feel right for you, I want to give you a reminder that you always have the right to switch so that you and your baby can have the best possible care. And yes, you even have the right to switch if you are well into your 3rd trimester and approaching birth. The third tip is to avoid the cascade of interventions. Now, this is a doozy, especially for first-time moms or moms who haven't had an unmedicated birth before. So this thing, the cascade of interventions, is pretty widely known about in the birth world, and it is essentially the theory that one small intervention can lead to a domino effect of a bunch of interventions that you didn't want or plan for, and ultimately lead to a C-section. I've seen this happen time and time again in my practice as a labor and delivery nurse. A common example I see of this is a mom who is in spontaneous labor and goes into the hospital. Her provider wants to start her on Pitocin to augment or speed up labor, those contractions become really difficult to handle, which leads mom to choose an epidural, which she might not have originally wanted. That epidural then slows down labor even more, leading to more Pitocin, which can cause these stronger, longer, harder contractions, not only for mom, but for baby. And then baby's more likely to become distressed. And all of this can kind of cascade, which is why it's called the cascade of interventions, into an unwanted surgery. And while some birth interventions might become necessary depending on your situation, it's important that you go into birth informed and confident, and you're making those decisions yourself rather than them being forced upon you. Many studies show that common birth interventions such as continuous monitoring, IV fluids, epidurals, Pitocin, etc., lead to a higher likelihood of a C-section. Now, to piggyback off of that point, a huge way to avoid the cascade of interventions is by making sure that you let labor start on its own. When labor is induced in a way that isn't natural to the body, it comes with a whole host of other interventions. Now, of course, there are times where waiting for labor isn't safe for mom or for baby, but that is going to be the minority of cases. And many providers suggest induction just electively because it's easier to schedule and oftentimes more convenient. Waiting for spontaneous labor has been proven to lower your risk of C-section, other unnecessary interventions, and leads to better labor progression and ultimately healthier outcomes for mom and baby in a non-medically high-risk situation. Remember that your due date is actually just an estimate, more of a guess date, and it doesn't really tell you anything about when labor is going to begin. It's perfectly normal and most times healthy for you to go past that 40-week mark. Remember that God designed your body for this process, and your body is smart. Your body knows when to go into labor. Tip number 5 is also off of that, avoiding the cascade of interventions, and that is going to be to learn how to manage early labor well and avoid getting to your birth location, especially if it's a hospital, too soon. One of the biggest mistakes that I see expectant moms make is getting to the hospital way too soon when they're still in early labor. The sooner that you show up to the hospital, the more likely you are to have other interventions pressed on you to speed up labor. So while you're still in early labor, it is best to stay home, hydrate, eat, relax, and rest as much as possible. And when things start to become too uncomfortable for you to ignore, try some of those coping techniques. We will talk about the best timing for you to go to the hospital in a different video, but for now, I am going to encourage you to research the 411 or 511 rule. But before you hit that point, make sure that you're laboring at home as long as possible in order to avoid the stress of the hospital environment and the unnecessary interventions that oftentimes come with that. And the last tip that I have for you on how to avoid an unnecessary C-section is to make sure that you're continuing to stay mobile throughout your labor and even during pushing. One con of getting to the hospital too soon is that you might run the risk of your team discouraging you from staying mobile during labor. But movement during labor is so crucial to encourage labor progress and overall make the whole process much smoother for mom and for baby. During labor, your baby has to make the journey from your uterus down through your pelvis and your birth canal, and it can be a little bit of a tight squeeze sometimes. But your movements on the outside as mama affect what's going on with baby on the inside. So movement during labor helps guide them into the optimal position and wiggle their way around all of those ligaments and musculature and bony structures that they have to navigate during the labor process. So make sure you're staying mobile and using gravity to your advantage. You can sway or walk or use the birth ball. Whatever that movement looks like, just make sure that you're changing positions frequently and not staying flat on your back in bed. And this goes for pushing too. Make sure that you're avoiding laying flat on your back the whole time that you're pushing, because mobility in the pelvis is equally as important during pushing as it is during the rest of labor. So to recap, the 6 strategies that you can use to help avoid an unnecessary C-section are to hire a doula, choose an aligned provider that is supportive of your goals, avoid the cascade of interventions, let labor begin on its own, avoid getting to the hospital too early / manage early labor well, and lastly, maintain your mobility and keep moving all throughout labor and avoid pushing on your back. Make sure that you're doing your own research and planning ahead, and I applaud you if you made it this far into the video. I hope that these tips help you to achieve the birth that you are dreaming of. If you found these tips helpful and you want to deep dive some more into these, you can check out the link in the description of this video to take your free mini birth class, or you can look at the full curriculum on my website, holyconfidentbirth.com. Thank you so much for hanging out with me today. If you're expecting a baby soon, please know my prayers for you, and I hope to see you next time.